Have you noticed that as cats grow older, they become pickier with food, develop more dental tartar, or have frequent digestive issues? In many cases, these problems are not caused by the cat itself, but by feeding habits formed during kittenhood. Today, let's talk about what feeding practices truly support a cat's long-term health. First, avoid feeding only soft puree-style food for long periods of time. Pureed food is easy to eat, easy to digest, and very appealing to cats. However, when a cat eats only very soft food, its teeth are rarely used. Over time, this increases the risk of plaque and tartar buildup. A better approach is to include foods that require chewing as part of the regular diet. For example, complete freeze-dried meals, foods with meat fibers, or textures that need to be torn apart. These provide light mechanical stimulation to the teeth and help maintain proper chewing muscles. That said, chewing food does not replace dental care. It only helps reduce risk and should not be seen as dental cleaning. Second, dietary variety during kittenhood is extremely important. From 2 months to 1 year of age, cats go through a food socialization period. During this time, the flavors, textures, and smells they experience strongly influence what they accept as food later in life. Many adult cats are not picky by nature. They simply do not recognize unfamiliar food as something edible. The correct approach is to keep the main diet stable while gradually introducing different complete foods, such as wet food or freeze-dried meals, as long as digestion remains normal. However, frequently changing the main diet is not recommended. It can lead to digestive upset and may encourage cats to wait only for more appealing food. Third, homemade raw diets are not recommended for most households. This is a widely shared view among veterinarians. There are 3 main reasons. First, there is no widely accepted, standardized recipe that is safe and nutritionally complete for home preparation. Second, raw meat carries bacterial risks. Freezing can slow bacterial growth, but does not eliminate it. Third, some parasites cannot be fully controlled by routine deworming. This risk is higher in kittens. Not all raw diets are inherently wrong, but for most households, maintaining safety and nutritional balance is extremely difficult and should not be attempted casually. In conclusion, there is no perfect feeding method. What matters most is choosing an approach based on your cat's age, health condition, and what you can consistently maintain. Reliable cat care is not about extremes, but about balance and consistency. If you want to avoid common mistakes, feel free to follow this channel for more evidence-based cat care knowledge.